Assalamualaikum and a very good day. I'm Lina. Today I will be presenting of my study on the title of The Role of Transformational Leadership on Innovative Behaviour among Nurse U29 in Kelantan Healthcare. So, for the introduction, I will start with the background of the study. Past decade research examining innovative behavior has become popular among researchers and practitioners. Innovative behavior is considered important because of the potential for employees to generate and translate the ideas into better organizational outcome, as well as positive association to job productivity, the production and contribution of ideas. In other words, innovation is the product of human mind by thinking outside of the box and the result of the employee's ability to sense or find new opportunities and change. Therefore, encouraging us to pursue innovation important because nursing innovation will enhance the quality of healthcare as well as facilitates nursing productivity. The purpose of this study to focus on the innovative behavior of nurses and the role of the leaders to enhance such behaviors. According to Weng Huan Cheng and Chang 2015, transformational leadership is greatly influenced innovative behavior among nurses. Innovation in practice doesn't and will not occur in isolation. It requires support from the leader. So this study aims at to determine the level of transformational leadership and innovative behavior, to analyze the differences in innovative behavior based on the demographic factors, to identify the relationship between transformational leadership and innovative behavior, to investigate the influence of overall transformational leadership and the contribution of each of transformational leadership dimension on innovative behavior. For this research hypotheses were formulated based on the research objective. Okay, let's move to the literature review. The study by McSherry and Douglas 2011. Nurses have to gain knowledge and skills such as applying new clinical technique in order to generate and develop new ways of working, as well as the use of the new technology, system, theories, and collaboration with the stakeholder as an agent of change that may further enhance and evaluate nursing practice. The study by Johnson 2000, innovative behavior consists of the three, such as idea generation, which is referred to the production of the ideas. Second, idea promotion, which is idea must be promoted to the others. And idea realization, by producing model of innovation that can be experienced and applied by work role, group, and organization. Okay, this study chose transformational leadership instead of other contemporary leadership because, according to Duff 2005, has noted that transformational leadership able to influence nurses and able to provide nurses optimal performance. Jivan 2008 supported this statement by highlighting that the significance of the transformational leadership to enhance the followers' value in order to make sure that their value align with the value of the organization. Therefore, Best and Review 2006 said that the characteristic of transformational leadership that leaders should possess, such as idealized influence attribute, idealized influence behavior, inspirational motivation, intellectual stimulation, and individualized consideration. So, previous study by previous researchers have noted that the positive impact of transformational leadership toward innovative behavior. Okay, for the conceptual framework, the conceptual framework was formulated based on the past studies. So, this is the summary of the methodology. The study is correlational since the main objective is to identify the relationship between the variables, which is the relationship between nurse innovative behavior as the dependent variable and then the transformational leadership as the independent variable. So this is the instrument of the study. The measure used in this study was based primarily on the MLQ, W and BUS 2004, and also innovative behavior was developed by Jensen 2000, and the demographic information. The total of the item is 37. So for the sampling technique of this study is simple random sampling. So let's move the population of the study. The population of staff nurses is 2,262 and the sample size of respondent is 327. So this sample size being determined based on the table Keji and Morgan 1970. So for the sample of each hospital was calculated by the formula from Jaya Shushma 2017. Of the 340 questionnaires sent out to the respondent, 320 were returned, representing 94% respondent rate. Another 20 due to incomplete and unreturned form. So this is the calculation of sample size by Jaya Shushma 2017. A total of 100 questionnaires were pre-tested on 100 nurses at Hospital Raja Perempuan Zainab II. So EFA is reduced them into a manageable number of items before further analysis. Principal component factor analysis (PCA) with a variant rotation was used for the item transformational leadership and innovative behavior. So the result indicate that KMO for transformational leadership is 0.983 and innovative behavior is 0.942. So all the constructs satisfied the EFA requirement. So for the Bartlett test, innovative behavior and transformational leadership was significant with a chi-square p less than 0.0. So this value means the data satisfied the requirement for analyzing EFA. So this construct achieved the total variance more than 60%. So this study also achieved the adequate reliability. So based on the findings, all 6 dimensions of transformational leadership were high. The idealized consideration dimension showed the highest mean value compared to the other dimension. The result showed the characteristic of transformational leadership, such as individualized consideration, stimulate more innovative behavior among us. Okay, for the descriptive analysis of demographic variable, as for age, majority of the respondents are 31 to 40 with a 47%, and for the gender, almost all the respondents are female, and majority of the respondents have been working 16 years above. Based on the findings, all 6 dimensions of transformational leadership were high. The idealized consideration dimension showed the highest mean value compared to the other dimensions. The result shows that the characteristic of transformational leadership, such as individual and Okay, for the result of independent sample t-test, the result of the t-test shows that male nurses had a slightly higher mean score of innovative behavior compared to the female nurse. There was no significant difference between the levels of innovative behavior between the male and the female nurse. So the first hypothesis in this study was supported. Okay, the one-way ANOVA test was used to test the difference of innovative behavior based on their age and lack of services. It was found that there was no significant difference in innovative behavior among nurses based on their age groups, which is p less than 0.05 in innovative behavior for the 4 groups. And there was no significant difference in innovative behavior among nurses based on their length of services group at p less than 0.05 in innovative behavior for the 8 groups. So therefore, hypothesis H1 and H3 was supported. The mean for the respondents' length of service group 12 to 14 years is higher than mean for the group 14 to 16 years. The post hoc analysis confirms that respondents with length of services 12 to 40 years have higher level of innovative behavior compared to respondents with length of services 40 to 60 years. So the mean for the respondents age group below 30 years is higher than the mean for the group 51 to 60 years. The post hoc analysis confirms that respondents with age below 30 years have higher level of innovative behavior compared to respondents with age 51 to 60 years. Okay, to answer the research hypothesis 4, the table shows the relationship between transformational leadership and innovative behavior. Percent correlation coefficient R shows that transformational leadership was significantly and positively related to innovative behavior, with the R equal to 0.52, P less than 0.01. So the H4 was supported. So to answer the hypothesis 5, based on the result, it shows that 0.276 of transformational leadership explain 27.6% of the variance. All dimensions of transformational leadership did not show any significant contribution to innovative behavior. Okay, to answer the first research questions and research hypothesis, this study reveals that the level of transformational leadership and nurse innovative behavior is moderate level in public hospitals in Kelantan. The finding by D. Bumping et al. 2016 is consistent with the result that the level of innovative behavior among nurses is moderate level. This study attempts to contribute evidence that nurses in Malaysia also need to give continuous effort toward their innovative behavior in healthcare. According to Zhang Zheng and Dafu 2018, the leaders who practice transformational leadership have proven able to give more contribution to enhance nurse innovative behavior. And the next is, this study found no difference in the innovative behavior among nurses in healthcare based on demographic factors. This finding contradicts with a study by Comas 2020 and Debumping 2016 that the level of innovative of behaviors of nurses has influenced by the age, gender, and length of services. The different finding might be the imbalanced response between male and female, which affect the significant difference between female and male of respondents regarding the level of innovative behavior. Innovative is important for all regardless of gender, age, and length of services. However, leaders and management need to further develop strategies to increase the level of innovation among nurses by highlighting demographic factors. Due to that, it can make it easier for the leaders to identify and help to approach group of nurses regarding the level of innovation. And then this study found that transformational leadership is highly correlated to the nurse innovative behavior in the healthcare. The result is consistent with a study by Al-Denat 2018 in Jordanian telecommunications sector, which the attribute of inspirational motivation, individualized consideration, and intellectual stimulation of transformational leadership had the strongest positive relationship with the product and service innovation. Furthermore, other findings found that those leaders had practiced the attribute of intellectual stimulation, able to develop innovation and creative thinking among employees. It can allow leaders to challenge employees to think outside of the box, and they use a new approach to solve the problem or work process. And lastly, the result of the fourth hypothesis, which investigate the effect of all dimensions of transformational leadership towards innovative behavior among nurses, show were not significant even though the mean levels of each dimension were high. This possible reason is that maybe due to the transformational leadership is not enough as a factor to contribute innovative behavior. Therefore, the leaders should consider other factors that can strengthen the predictable of transformational leadership to explain innovative behavior. The finding from previous study reinforced that transformational leadership has a stronger influence on innovative behavior when the mediator of motivation to learn is used to strengthen this link and effectively to increase innovative behavior among nurses. So the result of the hypothesis testing for the causal effect, only hypothesis 4 supported, which there is a positive and significant relationship between transformational leadership and innovative behavior. Okay, for the conclusion, present study investigates the relationship between transformational leadership and innovative behavior and has conducted in developing countries. Thus, this study can extend our understanding and knowledge of innovative behavior, transformational leadership effects from the perspective of Malaysia. Facts that have been highlighted can contribute to the organization to investigate more deeply the relationship between transformational leadership and innovative behavior. And lastly, thank you for listening.